I would like to welcome you to the West Tennessee Bone and Joint Clinic's Total Joint class presentation. I trust that you will find this video informative and very helpful. The Bone and Joint Clinic has 34 providers, to include 20 physicians, 19 who do surgeries, 2 interventional pain anesthesiologists, 1 hand surgeon, 1 podiatrist, and 14 physician extenders. These providers are trained in the following areas: shoulder and elbow, sports medicine, trauma, pediatric, hand, spine, and interventional pain. The clinic has 13 locations to better serve our patient populations in the following areas. There are 2 offices in Jackson, Tennessee, an office in Paris, Dyersburg, Union City, Ripley, Lexington, Brownsville, Huntingdon, Martin, Selmer, Savannah, and Trenton, Tennessee. The West Tennessee Bone and Joint Clinic has been a past recipient of various awards, including Reader's Choice Awards for Best Clinic, Best Orthopedic Clinic, Best Physical Therapy, and Best Occupational Therapy. Additional awards include Advanced Orthopedic Certification and Newsweek Best Ambulatory Surgery Center for 2022 and 2023. There are several locations to which your joint replacement may be scheduled. These surgical locations are as follows: Henry County Medical Center, Baptist Hospital, Huntington, West Tennessee Healthcare, Jackson Madison County General Hospital, Main Campus or North Campus, and the Physicians Surgery Center. The West Tennessee Bone and Joint Clinic participates in a specialized program called BPCI. You know, in the medical field, we love abbreviations, but we refer to these abbreviations as Better Patient Care Individualized. The clinic reviewed the statistics of this program and looked at how it works to optimize the patient's health prior to surgery. It also involves close monitoring and strict therapy protocols after surgery. It is for this reason that the clinic and its practitioners entered into this program to offer our patients an opportunity for excellent outcomes. The healthier a patient is prior to surgery, the better the outcome. At the clinic, we make a commitment to our patients. If they are not healthy enough to meet the guidelines of this program, we may not recommend they proceed with surgical plans until such time the patient is healthy enough to proceed with surgery. Arthritis refers to a condition of joint pain and disease that is progressive. It includes pain, swelling, reduced range of motion, and stiffness. Total joint replacement is a surgical procedure in which the surgeon will remove damaged cartilage and bone and replace it with an artificial joint called a prosthesis. Arthritis pain is progressive and ongoing. Surgical pain, however, is temporary and will go away. In this program, you will have a team of individuals supporting you through this surgical process. You will have care navigators that will call and check on you regularly to make sure you are progressing like you should. If there are any issues or concerns, they will be able to assist you in having these concerns addressed. You will have nursing care providing for your needs at the surgical location of your choice. There will be physical therapy to provide for your rehabilitation needs after you have completed your surgery. You will be asked to go see your primary care provider. You may feel like you are getting the runaround when you are sent to various providers, but there is a reason for this. There are specific tests that need to be done to determine if you are truly ready for surgery. If you are a diabetic, you will be checked to see if your A1C level is 7.5 or less. This tells us if your diabetes is stable and you are medically ready for surgery. In this program, it is preferred that your body mass index level, or BMI level, be 40 or less. This indicates if you are nutritionally ready for surgery. So let's say you are wider than you are tall. Then this level might be above 40. Should this be the case, you might be asked to choose a healthier diet to reduce your weight and participate in exercises that you can do in order to help reduce this numerical level to the desired 40.0. If you are a smoker, you may be asked to stop smoking 4 weeks prior to your surgery date. Your nicotine level may be checked just prior to your surgery, and if you test positive, it is possible your surgeon may cancel surgery. We are concerned about infection. We will ask that your doctor do a urinalysis on you to determine if you have a urinary tract infection. These infections do not always show outward symptoms until far progressed. You may be asked to see a dentist if you have not seen one in a while to determine if you have any cavities, broken or cracked teeth. Why are we concerned about this? A cavity prior to surgery can develop into an abscess, which is another type of infection. Why are we so concerned about infections? Infections tend to travel to the new joint replacement in your body. We do not want any infections. It could result in a person having to have IV antibiotics for 6 to 8 weeks or longer. And if it cannot be cleared, the worst case scenario is that the new joint may have to be removed and you have nothing but a spacer for a few months until your body can be cleared of all infection and then another surgery scheduled to redo the joint replacement. You do not want this, and we do not want this for you. A chest X-ray is ordered to clarify there are no infections or abnormalities prior to surgery. If you have a history of heart issues, you may be asked to see your heart doctor or cardiologist so that they can check you and provide a letter of clearance stating you are medically ready for a surgical procedure. If you have asthma or lung issues, you may be asked to see a lung doctor or pulmonologist so that he or she can determine if your lungs are healthy enough to undergo anesthesia. The same principle applies if you have a history of any neurological issues such as stroke or Parkinson's. You might be asked to see a neurologist for a letter of clearance as well. At some of the surgical centers or hospitals, a pre-admission appointment may be required where all of this information and testing will be reviewed to determine if everything needed is complete for your surgery to take place. Your care navigator and surgeon's team will review this information to make sure your clearances are complete and surgery is a go. Your surgeon will call in a prescription for you to your pharmacy that you need to start using approximately 1 week prior to your surgery. Be sure to check with your pharmacy. This prescription is an ointment. You will need to swab each of your nostrils in the morning and evening for about a week prior to your surgery. Please read the instructions on the prescription label. This treats you for the bacteria MRSA. You may feel like, I don't have this bacteria, but it is on all surfaces in our community. So this is a way to treat everyone effectively. If you go to Kroger or Walmart and push the cart and then rub your nose, you could transfer germs to yourself. Your surgeon's team will tell you the date and time to arrive at your surgical location. You will need to have your identification and insurance cards with you and a list of your medications. Please bring clothes that are loose-fitting to put on after surgery. You will need shoes that support your foot, like a tennis shoe. Do not bring clogs or slip-on backless shoes. You will need to bring a walker to leave in your car, so when you are discharged home, you will already have it in the car to help you get in the house. The surgical center or hospital will have walkers available for you to use in the room right after surgery. Your family members will be instructed where to wait during your surgery. A cell phone is a great means of communication between the surgery team and your family. You will be taken to an area where anesthesia will talk with you about sedation and possible pain control for your comfort. There are various options for numbing the nerve or joint that help with pain control. This will be discussed with you at that time. There are two different options for sedation, and those are general anesthesia, where they give you something through an IV to put you to sleep, and then put a tube down your throat to help you breathe better because your lungs will be so relaxed. You do not know when the tube goes down nor when it comes out. The other sedation option is a spinal, in which you receive an injection in the back that numbs one or both of your legs to help control pain. You are still given sedation through an IV, but it is not as deep of sedation, so a tube is not needed to help you breathe. These surgeries usually last 1 to 2 hours, and then your time in the recovery room may vary, depending upon how quickly you wake after surgery and if your pain is controlled. If you need some pain medication while in recovery, it may delay returning to your room. Your family members should not worry. The surgeon's team and surgical staff will provide family with regular updates. Nursing will go over bandages and care for after surgery with you and your family members. You should have an incentive spirometer or breathing machine that will help you take deep breaths after surgery to make sure your lungs stay good and clear. Keep this breathing machine close to the area where you will be, so it is handy to use multiple times a day once home. You will get up and walk the day of surgery prior to going home. Be sure to do your ankle pumps once home to promote good blood flow and circulation. You will be expected to eat and drink and go to the bathroom prior to discharging home. Ice and elevate to prevent swelling. Move that knee as motion is lotion. Hip patients need to be getting up frequently as well. Be sure to respect your hip precautions. Get up and walk around once home every hour you are awake for 10 to 15 minutes. Exercises you are provided before surgery will help you have a better outcome after surgery. It is recommended that you take your prescription pain medication approximately 1 hour before your therapy sessions. Be sure to take these with food and drink on your stomach. Our patients work with the surgeon and his team to determine what will be the best plan for therapy following surgery. Most patients will do outpatient therapy after surgery. It produces the greatest outcomes. Sometimes home health will be an option immediately following surgery, but then a patient will later be converted over to outpatient therapy. In this program, our surgeons and treatment team make a commitment to you that we will strive to see that you are as healthy as possible prior to your surgery, or we may recommend that you not have the procedure. We commit to you that we will follow your care closely with phone calls and follow-up office visits to ensure that you are being monitored closely so that any potential problematic issues may be identified and eliminated quickly. We, however, ask for a commitment from you that you will do the following. Call us first with any medical concerns or health issues and questions. We have someone on call 24/7 whenever the office is closed, so that there will be someone there to answer your questions and address your needs. We ask that you do not schedule any general medical appointments or procedures such as eye exams, eye surgeries, mammograms, colonoscopies, and dental work for 90 days post-surgery. This is your most susceptible time to pick up infections and sickness. If you have a family gathering and you know that someone is sick who plans to be there, well, we ask that you rethink going to that gathering. Avoid going to the emergency room, as this is the worst place for you to pick up illnesses and bacteria. Call us first and allow us the opportunity to address your concerns. Now, with all of this being said, if you think you are having a heart attack or shortness of breath, go to the emergency room, because this type of situation would override your exposure to illness. Be sure to keep your follow-up appointments with the surgeon and go to your therapy appointments as scheduled. Something else you need to remember: constipation is very common when one is taking these prescription pain medications. Please have laxatives and stool softeners already in your home before surgery, and make sure you are having a bowel movement at least once every 3 days. And if not, take a laxative to see that you stay on a regular schedule. Your prescription pain medications are usually called into your pharmacy a day or two before surgery. Make sure you have these picked up and at your home before your surgery date. Everyone will be sent home on some type of blood thinner. Be sure you understand what you will be taking and how often. This video presentation should provide you with the needed tools for a successful joint replacement experience. We are looking forward to working with you.